You're listening to the MINT Project, the podcast to elevate your knowledge on pregnancy and postpartum fitness, nutrition, and more, along with parenting, business, and advice to keep you living your best life. The MINT Project is led by your expert trainers, Betsy Jones, Kara Forrester, and Jess Carr. With that said, let's do this.
All right, Dr. Fisher / Amanda. You go by Amanda, which I love. So Dr. Fisher is a doctor of physical therapy, specializing in pelvic floor, prenatal, and postpartum support. She is also hilarious. If you don't follow her on Instagram, you need to go find her right now. She puts out content on Instagram in a fun yet informative way, which we just were so drawn to. So thanks for hopping on today. We've been followers for a while and so excited to finally connect.
So much. Thanks for having me, and thank you for that's so kind. I'm not good with accepting compliments. So that's my goal in 2023 is to really appreciate it. So thank you so much.
You are so welcome.
It comes across in such a good way that makes people not as feel weird about the stuff that you're talking about, which is
I think that's the only way I've ever been able to relate with people, because going through it with myself, having had those issues, it was just it's so negative to talk about, or people hide it, and we giggle about peeing our pants. So let's make everything else add a little humor in it for people to feel comfortable enough to open up. And it's been amazing what is actually, has come out of it with it.
Yeah. So tell us the background story. Tell us your background. How did you get into what you're doing now? How did this begin? When did it begin? Tell us all that.
Yeah. So I played sports my whole life, volleyball, basketball, ran track, and I had lots of injuries, which led me into physical therapy. So I thought I would do sports med physical therapy. I went into Mizzou, University of Missouri at Columbia, and was an athletic trainer on the sideline for the football team, and worked with injuries there, and got into physical therapy school and started having pain with sex and not really knowing how to treat that. I got sent to my gynecologist, and she was, have a couple glasses of wine. A couple of us have heard that before. Everything will be fine. And it wasn't. I either got too tipsy where nothing was happening, or then it was all in my head and anxiety would spike. And it just wasn't working out. So I'm like, okay, Cosmo's telling me everything's rainbows and unicorns and fireworks, and I wasn't experiencing anything, nor was I experiencing what an orgasm was. So because of pelvic pain, right? Well, our physical therapy class in grad school took a trip to what we call combined section meeting. So this is a big trip this year, this February. It's happening down in San Diego, which is where it happened for me. So it's kind of nostalgic. And down there, our class had to go to every specialty in physical therapy so you could learn what each specialty was, which, again, I thought physical therapy was all athletes. But come to find out, we have geriatrics, we have pediatrics, so you can work with the older population, you can work with peds, you can do cardial palm and be in the hospital setting. But then women's health is what it was called at the time. And the title of it was something around Orgasms 101. And went out, had a little too many drinks with my classmates the night before. Somebody had to be at that class at 8 a.m. And this is 2 o'clock in the morning. And a classmate and I pulled a short straw, have to wake up for an 8 a.m. class called Orgasms 101. We should be excited about it, but we had to be up super early. Well, we went to that class, and it was all about not having an orgasm, having pelvic pain, and peeing with running, which I was doing at the time because I was training for 6 or 7 half marathons a year. It was ridiculous. It was my stress reliever at the time. And sitting there, I'm like, oh my God, this is me. Or this is me. Did they read my diary? How do they have all this information about me? And it kind of opened my eyes to a new set of physical therapy. So while in grad school, I left the combined sections meeting. I immediately got online, myself and this same classmate, and we started looking for what we call continuing education hours of who had physical therapy within the pelvic health or women's health realm that was willing to take students. And so we found Herman and Wallace and the American Physical Therapy Association both allowed students into their level 1. So we went over Christmas break that year and for a weekend out in Chicago. So Friday, Saturday, Sunday, went in and dove in between our classes and absorbed everything we could on pelvic health. We came back, we talked with our dean about us talking to our classmates about it, which we did. We ended up having also only receiving a 45-minute presentation on the pelvic floor muscles themselves within our class, which is not enough. And a lot of things were avoided during our anatomical labs that we should be talking about this and knowing what's providing support and urinary function and so much more, but we didn't at the time.
Yeah.
And so we decided to do that. And her and I now are still very well involved in the pelvic health world. She's actually in the Army doing pelvic health research, which is amazing. And then I myself am out here in Kansas City. So long story short.
That is so cool. I love it. I love all the details.
Such a good story.
That's really cool.
Thank you.
Awesome.
I love how you dove right into that. Like you saw it and it resonated with you so much that you were like, all right, let's go. Let's full force decision made.
And I'm not going to lie, like this is 2009, 2010. So Instagram wasn't a thing. And if it was, I didn't know anything about it at that time. Facebook was a thing. We're in a smaller community when I was still in school, I guess, where I was bringing it up with patients who were coming in just to see if they would talk to me about it. And then people started opening up that they were having these issues. And at the time, statistically, it wasn't near as high as what we know now because people are being more open about what's happening to them. But we knew, I think at the time, it was like 1 in 4 people peed their pants with coughing, sneezing, laughing. We now know it's 1 in 2. But at that time, it was like, well, let me see how many people can actually agree to it and see how many people it's actually happening to who I'm working with. And I remember calling my husband. I was going on a clinical in St. Louis. We live in Kansas City, across the other side of the state, and asking him like, hey, this is a realm I want to go into. I know I went in, took the courses on it, but I really feel the need that I'm called to be here in this position. And he was like, okay, like didn't know anything about it. It was kind of weird. Pelvic health. And at that time too, I think I had flown back from this course. We had a Christmas party. He's an engineer. So you can imagine going to a Christmas party with engineers and then being like, what do you do? And my first thing out of the gate is,
oh my gosh,
hi, I'm a women's health physical therapist. I help people pee their pants or stop peeing their pants and peeing with sex. And my husband's over there like, stop. Too much.
Gosh.
Close the floodgates. But I wanted everybody to know that this is a thing because I was dealing with it. And then realizing like we got to backpedal a little bit and then slowly introduce it. But now bring forward to 2022 Christmas party with the same company. I have all these moms coming up and asking questions and talking. And my husband's like, more people know you here than they know me. I'm like, I know.
Sorry.
This is so much fun.
Oh, great.
We're just networking left and right and talking pelvic floor. And it's so much fun. I absolutely love it.
Yeah, I love that because so my daughter is almost 9. And so when I had her, it was like, the beginning of Instagram. I don't even know if I had an Instagram. No one talked to me about any of these things. I struggled with incontinence, peeing your pants, and all the women at the gym kind of joked about it. My doctor was like, not much you can do other than eventually we can have surgery. Like not once was like told I could go see a pelvic floor specialist.
Right.
And so I think it's so cool. Like you are so funny on Instagram in the way that you put your content out there that I think it helps women feel more comfortable talking about it. Like we take away the embarrassment and it's like, oh, I can go talk to her because she's funny about it and she makes it easy. So we kind of wanted to like dive into some of those like, hush topics like peeing your pants and have you kind of elaborate on how common is that? Why does it happen? Maybe just starting with that one. Why does it happen? And then what can women do to improve it?
Yeah, so that's a great one. We used to think back in 2009 era that, you were only, if you peed your pants, it was normal because you had kids. And it was really unheard of to have the population who were younger, maybe high school or collegiate athletes who were leaking. And I started noticing that with our own patients within orthopedics, that is gymnasts or cheerleaders or girls that were kicking soccer balls or having giggle incontinence when they were laughing, it was like, oh, something's wrong with their bladder and they're not emptying all the way. But honestly, like the pelvic floor plays such a toll in that. And we see that here now. It is common, around 1 in 2 women will experience some type of leakage, definitely after baby, but within their lifetime. The muscles themselves, for like the athletes, what we tend to find in the clinic, their muscles hold more tension, meaning they're probably strong all over, which their pelvic floor is too. And we've got to teach those muscles, just like your arms and your legs can, to let go and to release. And most often, and I was this way too, a lot of our athletes that come in are like, stretching, I don't stretch, or I stretch right before practice, but I don't stretch afterwards, or I don't do yoga. And really showing them the benefits of, you do it with these other muscles. We need to make sure that the muscles down there are contracting and relaxing as well, so they can function to where you want them to be with kicking your soccer ball or throwing a softball or whatever activity that you're doing, picking up your kids during postpartum or pregnancy. We need them to make sure that they're moving fully. Very common during pregnancy. We see this, especially with having, I feel like the more pregnancies you've been through, the muscles need a little bit more reminder of how to work a little sooner, because those muscles are stretching out or changing in earlier in that pregnancy timeframe. By postpartum or by the 3rd trimester of pregnancy, I like to tell patients that muscles kind of go on vacation that are at the front portion of our pelvis and our abdomen, because they're being stretched, and the backside likes to hold a little tension. So you have to remind that tissue, it's all great. Everybody needs to go on vacation, but we also got to come back in and help out, because we've got a lot of type A and type B personalities down there, and let the type Bs help out and do a group project together, because that's when optimal stuff happens. I love that. And when people are slacking in group projects, we see issues pop up. So we need to make sure everybody's on the same playing field. And that, because it is so common, common is my big word, not normal, common. Yep. The normalcy with the muscles is that they control and we don't have leakage. They let things out when we ask them to, but when we need them to not, they should be able to kink that fire hose on either end and keep the goodies in. So it's just teaching those muscles, retraining them how to do that again.
Awesome.
I kind of have a follow-up question with that. This just popped into my head. So have you found, like, high-level athletes or even just regular female athletes, that they have a harder time kind of relaxing and dilating for birth? Do you find that, they normally have probably a higher percentage of pelvic floor injuries during birth, or they resort more to a C-section because they just can't relax? Do you find that that's more common or not?
I see what we see in here. If we see them during pregnancy, it seems like we can avoid the tearing or avoid, let's say like a grade 3, grade 4 tear, because we've taught them how to relax or to lengthen the tissue during times of pain or during childbirth. And then if they're definitely a second timer, like we saw them maybe postpartum after their first, and then saw them, they came in during pregnancy because they're like, ain't going through that again. Things end up so much better afterwards. I do see a lot of our high level athletes that maybe train for like Ironmans that come in. You can almost pinpoint that if they're not going to do some sort of stretching or mobility work during their pregnancy, it tends to go that route. Now, I'm not doing research on it to say that that's a guarantee, but that's just, we highly recommend adding in the mobility and stretching and releasing and not just focusing on the strengthening, because it does look like a better outcome delivery wise and what's happening during that 4th trimester if we can add that in.
Awesome.
Well,
thank you. Yeah.
And I think that that's a common thing that at least I, before diving into what I've dove into the last 2 years, you think, okay, I need to do Kegels and I need to strengthen my pelvic floor. And it's not that black and white. And I loved how you talked on it needs to know how to work, not just strengthen, not just relax, but both. Can you talk a little bit on like how the brain of the pelvic floor kind of works and why it needs to be able to do both interchangeably?
Yes. So functionality wise, those muscles they have a sphincteric action where they need to close to keep the goodies in. So to keep your feces in, to keep your bladder urine in, they need to keep things in. So that's going to contract to have that happen. But when you sit down to go to the bathroom, those muscles relax to allow your goodies out, to let urine come out, to let feces come out. So that's one action. They're also supportive. They hold up our organs. They hold up our bladder, our rectum, and our uterus. They're also sexual in function. So to allow for orgasms to happen, they have to have a full relaxation and contraction, because orgasms are very quick contractions down there. But if a muscle is not having the full range of motion where it can do that, we're going to be lacking orgasm or having pain when we get to that point, or just hitting arousal and feeling discomfort and pain. So there's those muscles we have to be able to know, can we squeeze? Can we relax? Can we bulge down a little bit? Not bulging where you're doing a Valsalva maneuver and trying to push it all out, but can we bulge just a little bit to go a couple millimeters down? So we like to talk them through like an elevator. I always say initially, like, it's not all about Kegels. That's a common misconception. Like, Kegels were thought of, everybody needs to strengthen the pelvic floor. However, there's so many muscles down there. There's not just one big muscle. There's over 26 to 28 different muscles down there, depending on what research you look at, that lots of room for compensation and error. So in order for us to get all those to work, there's different ways to trigger those muscles to connect. So for the contraction standpoint, we like to say, like, think of picking up a blueberry or sucking up a smoothie through your vagina. So you have that in your mind. That's that pickup. That's that elevator going all the way up to like the first floor. Okay. Can you take that smoothie, blueberry elevator up to a second floor? Can you contract it a little bit further? Now, can we release that elevator all the way back down to the lobby? What does that feel like? Can we make that go, let's say you have to go to the parking garage that's under the main lobby. Can we go a little bit down, a little bit more relaxed? And we need that pelvic floor functionality to move that way. If you're unsure about that, you got this lovely hand that reaches that area. You can go down there between those bony landmarks, your sits bones, feel that tissue. So often when we contract that tissue, people do the opposite. So when we squeeze, sometimes people bear out. And when we relax, sometimes people squeeze up. And you want to make sure what you're telling the muscles to do, you can feel that actually happening. So we have patients do that in the clinic on the table. I like to look at them on their back with us, one gloved hand digitally inside, and feeling that tissue, what's happening. We've got 3 different layers happening, but then I'm very big. I'm a mom of 3 boys, and it never made sense to me to treat just on your back, because that's not real life. That's not motherhood function for me. I had a lot of pelvic floor issues after my C-sections. So we also look at patients sitting on the edge of the bed, moving from sit to stand, and I'm inside vaginally, what's going on, or inside rectally, if that's the area of issues. I have them stand. We're feeling what's going on. I have a mirror down there. We're looking at it. And then, like, I have a gal right now who's peeing her pants while rebounding a basketball while she's coaching her daughter's basketball, and then spiking a volleyball at the other daughter's volleyball practices. Yeah. So I have her. She's had kids, so she doesn't care about down there. So she's just standing, nothing on, waist below. And we're looking, and I have it internally feeling what's going on. And then vaginally, we're looking at it with a mirror, and I'm showing her, this is what's happening, but you're holding your breath while you're doing this. And that's why we're peeing our pants and we feel that pressure there. So we're going to change up the pressure system, because that's a really big way of how those muscles work. It's not just about the contraction relaxation. The breath always wins over those muscles. So if you're holding your breath while trying to do activities, that can really play into what's happening or not happening down there. And so for her, it was really just teaching her how to decrease that pressure by blowing out, maybe adding in a little support right now. And then we moved to the gym and are jumping boxes and lifting 50 pounds with a barbell and weight on the sides, and she didn't have any issues. So it's really breaking it down, because we see so much on social media that says it's all about Kegels, or there's nothing to do with Kegels. And I feel like we're missing a point, and it's so controversial right now within pelvic health, but
I love it. Bring it out.
We're missing the point of how are these muscles functioning first, and we can touch that tissue. So know how yours works before we skip the little steps. Make sure you've got the little steps, the foundation, and then we're moving through all functional motions, but we got to make sure like the baby steps are there too.
Yeah, and
I love that.
that is
I
like
love how passionate you are too when you're talking.
Yeah.
You can tell like
Here.
I love it.
It's because like you've been through it and then you found relief and found help and hope and you want to provide that for other women. And you can totally see that when you present
Yes.
and you do your content on Instagram. That's how we feel. That's why we started what we're doing. And so it's really cool to see and to interact with you and see that same fire in what you do.
Thank you.
So,
yeah, and I was gonna say,
I feel like I'm
I know.
out right now.
No, not at all. I mean, it can be literally life changing from someone who has been to the gym and like peed their pants in light colored leggings. Like, there's women that just won't wear lighter colors, or they won't do movements because they're scared that they're gonna pee their pants. And so, just like encouraging women to somehow find a way to be comfortable going to see someone like you. Because, yeah, it might be a little awkward at first, but once you get to know you, it's like we are figuring something out that quite honestly is going to change your life, and you're not going to have to worry about wearing the right color pants or whatever that may be. So I love that. And I also, I remember kind of growing up as an athlete and even just like in the fitness industry, always like, suck it in, keep everything tight. And I think that also has a major impact on like it took me a while to be like, dude, relax. Like, you can let your stomach go. It's okay.
Yes. And I feel we've got a membership group that I call the Pelvic Posse within our realm of Empower Your Pelvis. And that's the one thing I have to remind with the girls anytime we're doing relaxation stuff. It's like, not always your pelvic floor, but what is your belly doing? Because whatever your belly's doing, that pelvic floor is doing. They go hand in hand. They're besties. Yeah. And you get so focused on things that then you're like, oh my God, I am like stuck in the early 2000s holding this shit in all the time. And I gotta let it go. Yeah. So everything can move and function how it's supposed to. But we're so worried of the flabby stomach, I think, especially my postpartum moms, they're like, well, I've got to help it somehow. I was like, well, then let's do it the right way. You know, the same way we would if you injured your knee or your ACL and you had to go in for physical therapy. We focus on these muscle groups, and that's kind of what we've got to do after having a baby. It's not jumping back into your jeans 4 weeks postpartum. That shouldn't be your main focus. Our focus needs to be to get everything to build back up again to support you overall while you're carrying around your babies and toddlers.
Yeah.
Absolutely.
It's so cool to see. Like, I can imagine you have women come into your office that you're going to go inside and examine that are pretty like shell shocked when that's about to happen and feel maybe negative feelings either about themselves or self-conscious or whatever, when instead that can be a really cool, empowering moment of like learning how you work or looking at what's going on down there. And I think you definitely are emulating that. And I love that. I think all of us feel very passionately about getting women to take a little bit of control of their bodies, whether you're an athlete thinking that you have to live up to this standard or just a woman thinking about the woman standards out there of holding your belly in. And this being not an area that we talk about, like that entire overarching energy here is just so refreshing. And I think is hopefully starting to spread among women, not just in a fitness world, but just in general.
Yeah. I would hope so too. We, especially over the last couple years, have dealt more with the trauma side of what's happened postpartum with COVID deliveries. Yeah. And so I've always felt and have always worked with, we hold a lot of emotion down there. So we do trigger different emotions to be released when, sorry, the phone's ringing. Different emotions that are released when we're doing pelvic floor examinations. And whether that is maybe we're hitting like the backside of the pelvic floor because they had a tailbone injury, or their pelvic floor kind of gets shell shocked depending on what kind of delivery they had. And it's kind of like, what the just happened down there? And it can go into tension hold. And we're working through that. And while we're doing manual stretching, sometimes our moms will be very vulnerable and open up and tell us their stories. And then we're, with that vulnerability, usually referring on to some kind of psychologist or therapist that can help work with them through that, or them and their partner as well, so that we can make greater gains doing what we need to do too, depending on what they came in for. But that trauma side of it has really spiked from what we've seen on our end in the last 3 years since COVID, just because some of them test positive for COVID and the babies have got ripped away, and they've got all sorts of stories that we do not take lighthearted. We are definitely helping them work through that, but we are not a licensed therapist in that regard. So we definitely refer on for that.
I love that you said that you will refer, you take that information, you refer on. In our course, our trainer's course that we have, that's one thing we talk about is building a network of professionals. We're personal trainers. That's what we do. We're not pelvic floor physical therapists. So we need to build those relationships. We need to have, therapists, psychologists that we trust, that we can refer to our clients, because hopefully by then our clients trust us if they're sharing info with us. And then we can refer them to more people who can help, and just creating a team of women or a team of healthcare professionals to support women in their journey.
Just like the pelvic floor, you have to have everybody on board, because one person can't do it all. We're going to miss so many different puzzle pieces. So we love collaborating as much the best we can, whether it's in person locally or virtually, since nowadays virtually is so big. It's so wonderful to know people across the states or even internationally that we can refer on to.
Yeah, I love that. That's awesome. So what would be your suggestion to a mama who's recently had a baby and she's maybe nervous to come in and see you, just kind of like break that initial barrier? What's something that we as coaches or we as friends or something, how can we kind of say, like, it'll be okay, just go see, just go try, just go try pelvic floor physical therapy?
Yeah, how do I say that? I feel as if pelvic floor PT should be a physical that you have after having a baby. Like, I've had talks with providers that, I don't think everybody needs to go to pelvic floor PT. And I'm like, I beg to differ, because we do have so much that's happening down there, and everybody's their own individual. It truly is. How people hold themselves, how people use their posture with carrying kiddos or car seats, or how they're nursing, like it all plays into a huge ball game. And if you can have that physical the same way we send our kids to physicals before they start a sport, that would be very beneficial for you to know where to focus your attention, even if it's one visit, one physical to check in, see how that tissue is responding and giving you ideas of where to focus, and then moving on to a personal trainer. That would be huge, because at your gynecological visit, at your 6-week checkup, you probably are only getting assessed on your back. And again, you're spending probably 23 hours of your day, especially if you have a colicky baby, standing up and bouncing, or you're going to go back to work at 6, 10, 12 weeks. And if you're a nurse or a teacher, you may be on your feet for 10 to 12 hour days. And that's when I would love to see them sooner, so that then when we get into the later part of that 4th trimester, we're not like backpedaling to try to build up tissue, and then you're going to work a 10 or 12 hour day. So that was kind of, that actually clicked for me yesterday as speaking with her. It was like, we need them as a physical. And that was the easiest way I can explain it, is just come in, get assessed. It's not scary. We have this fear, I think, of pap smears and speculums. You're like, oh, give me the ped size, please. Like, I like a large one. And it's totally different. Like, my fingers are probably the same size as a ped speculum, and we're not opening it up. I just need to know, like, what's happening.
What's going on?
We are really good at feeling what muscle tissue is doing. So I'm not going to push the muscle to fight me. I just want to know, hey, buddy, how are you over here? How are you over there? Let's do a few things, and let's go in and like, are you moving or are you not? Where's the scar tissue? If it was on your knee, hip, back, shoulder, we would assess that tissue.
Right.
The same way down there. And I feel like 9 times out of 10 when people leave, they're like, oh my God, that was fabulous. Like, that was so much better than I thought. I'm like, yes, I don't know where the scary tactic is coming from, but the only thing I can think of is the speculum, because that thing freaks me out. So it's much more calming. We're like a bunch of girlfriends, and I hope that gets portrayed on social media. We do love having fun, especially here in our clinic. You may walk in while we're filming a reel. It happens all the time. But We're just very lighthearted. We're truly here to care for you and figure out, I don't typically give exercises to new moms that are 10, 15 minutes because as a new mom, I didn't have that.
Yeah.
That amount of time for myself, or having 3 kids, like that third kid, it was like, I have 30 seconds probably to myself.
Literally. Yeah.
And I probably didn't brush my teeth until 6 p.m. that day. So what can I do? Small little increments that I'm already doing with the baby to set myself up for success instead of me feeling like a failure because I didn't hit a 5 or 10 minute workout for the day. I want to hit those little things first. And then as I feel successful and I've hit my goals and I'm doing better with my pelvic floor, then we're going to add on bigger exercise programs. But yeah,
that's awesome.
Hopefully that I'm really good at long-winded answers today.
I love it.
Perfect.
I love it.
Things are relatable too, like a physical for your child. Of course, you're going to do that before you send them into sports. So why wouldn't you do the same for yourself before you take off to work again or back to, life?
Yes. And I think with littler kids, we don't typically think about that mindset because you've got babies, right? Like one of our girls is going through the new mom 6-month phase right now. But my kids now are having physicals for sports. And that's where it clicked. I was like, oh my God, like we do this for our kids. We've done it for ourselves. But why are we not doing it for ourselves in this, period that could play so much into the rest of our life as we're moving through, that perimenopausal phase and then into menopause down the road, which I don't even want to think about, but I'm there. We got to prep that tissue.
Yeah. Right.
Yeah.
We always say too, if an athlete had an injury, not comparing pregnancy to an injury, but like a surgery, right?
Yeah.
They go to, that's like a no-brainer that they typically would go see a physical therapist. So why wouldn't we send someone who just had a C-section or even a vaginal birth to go see a physical therapist first to make sure they're all good? So we always preach in our exercise programs, like step 1, we believe you should see a pelvic floor physical therapist because if you start doing our program and there's stuff going on, now we're going back rather than let's take care of that first. And then you feel great to go into our program.
Yeah. And some people are maybe that physical and then they're good to go. Like you birthed a baby, maybe you had a little whiplash injury down there, nothing's torn. Yeah. Those people are good to go typically, but it is our sometimes our grade 2, because maybe they were really a grade 3, but those tearing or cesareans, the major abdominal surgery, when we hit that grade 3, grade 4, and those need a little bit more tender loving care and a little bit more guidance. And those are the ones that we definitely want referred on. But yeah, we preach the same thing. Like, was it a joint injury, a rotator cuff? Did you tear a complete muscle? And what is that? We have protocols, for those as PTs, how to handle that we've now created our own here at our clinic on okay, if it was not tearing, this is what we look for and where we need to be at this time frame. If we've torn a grade 1, a grade 2, grade 3, grade 4, or C-section, this is where we expect to be. Now, everybody's different, and my girls know that. I've been trained on that we may jump ahead, or because we have a colicky baby or we're dealing with prolapse, we may be taking a little bit longer to get back. But so often too, during those time frames, because we know how much community means to them and we know how much the stress relief, we're wanting them to get back with their personal trainers. We're wanting them to get back into, whatever gym they're going to, but we need to be their accountability partner too during that time. Because what we saw in the past was they would go into that stuff and then forget and just push through peeing their pants again or push through the pressure down there. And we want it coupled together. So that's why I love working with trainers that we have even gone out in our community to talk them through it and what they're noticing. And we're going to work as a team together to keep them in the gym with y'all. But then we need to make sure that they have checked all the boxes before we feel good to release them too.
That's great.
Love that.
I love that you're working with trainers, and I wonder if there's more out there, or if you have even guidelines for other pelvic floor physical therapists or trainers on how to continue bridging that gap and make sure that, like we've been saying, it's working as a team. Because I think if you leave it up to the client, it can get a little confusing on, what my PT said I should do, but how does that apply to this programmed workout today? Do you have advice for trainers on how, or physical therapists on how to kind of build that relationship and make sure that the client is responsible for playing telephone?
Yes, I think if the patient can definitely verbalize or sign off on the two communicating, that's huge.
Yeah.
And then, because there are things that they're going to forget to tell us that they will tell you, or vice versa. And us being mindful of like, hey, Jess, she's going to see you today, but she's been up the last 3 nights with the baby. She hasn't been getting a lot of sleep. So we've been noticing the pressure down there has been increasing. Just a heads up, because the baby's, I don't know, 12 pounds, but when she carries her toddler at 32 pounds, she's also still feeling the pressure. So just if you want to you might want to decrease the weight today, but totally up to you. Test it out, modify it as needed. But that's what's going on from what we've heard today. And I think having those conversations in a similar fashion like that would be huge. And then on both ends, making sure we're asking the questions and not, I used to get so red cheeked and like, oh, did you pee your pants today? And now it's just straight up, we've got to know what's happening down there, or I can't help you. And being vocal and okay with asking that, because that's what you guys do in the prenatal and postpartum population, which I'm not. I real honestly, I think everyone who we've worked with and you guys as well are already doing that. And then continuing, I feel like the patients want having a good accountability and follow up with them on both sides would be huge, because that's when we see the fall off too, is maybe the trainer there, or I would say the accountability piece is probably the biggest.
Awesome.
Okay, so you are a mom who's had 3 C-sections. I have 2. I just had my 3rd one in July.
Congratulations.
Yeah, thank you. So I learned that when I was looking through your Instagram. But what have you found? Because for me, sometimes I'm like, well, I had a C-section, like I don't need to go to PT, or there's no exercise I can really do to like help that area, you know? So what have you found to be the biggest help with C-section scar recovery? And like in our profession, you know, we have certain movements that can aggravate that area. Sometimes like a barbell hip thrust or a snatch, that's where the bar typically hits. We've been dealing with that. Sometimes muscle ups, you know, or even just like playing around on a bar hanging from the, you know, the wall or whatever. So what have you found that's really helpful for kind of healing that area?
That's a loaded question. So I agree. I feel like our society and in the pelvic floor, it was kind of like C-sections. We don't need to see you. I disagree. I feel like we really need to get those in because of the major abdominal surgery side of things. I myself ended up with high sensitivity in the clitoral region with the way nerve tissue in the scar had healed. And I would be doing activities in the gym. And I mean, it would feel like a full-blown orgasm was happening, and it shouldn't be out in public. And it was annoying, which you would think normally like, oh, that's a great thing. Not in public. Or pain with intercourse happened. And those were things that it was uncomfortable those are, and then pain with bladder filling up. I had a lot of bladder discomfort as well due to scar tissue. So we've got 7 different layers that have really been hindered as they're going through the C-section scar. And you're getting separated on that tissue. So that tissue, there's a good chunk of like 1.5 inches to 2 inches above the scar and about 1 inch underneath of it that we've got to work all that tissue after having the baby gently. And then after you get released from your doctor, really doing scar work as well. Now, research wise, there's not enough done on the C-sections, in my opinion. We have research on tummy tucks. So in tummy tucks, they're promoting 12 weeks solid. My sister's in lymphedema physical therapy, so I get all her research, but they're promoting physical therapy after tummy tucks because of the lymphatic flow. And this is what I had after my babies. You would notice this pooch kind of happening underneath the scar. So you've got your shelf up top of the scar, but then below you get this little pucker of fluid. So it was, okay, what supportive garments? I'm huge on getting supportive garments. I love Bay has great support bands that we do during pregnancy, but their postpartum biker shorts and leggings are fabulous. SRC Health is another one. But wearing postpartum biker shorts for that first year postpartum can be very beneficial. It's like wearing an orthotic in your shoe if you had plantar fasciitis, but we want to help support that tissue and lymphatic flow for healing. So for you, Kara, that would be perfect for you to wear at the gym too, because they're really giving and very helpful and supportive for the tissue. Not being afraid to touch the abdominal and scar tissue. A lot of our patients are nauseated feeling or have like just this squeamish, like, oh, the extra skin, it's all stretchy and feels weird. And you're like, okay, well, let's start up at the belly button and let's feel how that is. And I want you to move down until you feel that squeamishy feeling. And then you're going to go up a little bit. And I want positive thoughts. I do lots of positive thoughts and affirmations while we're touching that tissue, because women feel such this negativity, especially if they look in the mirror and see this squiggly smiley face on their belly. So we do a lot of positive work and tissue healing there. And then because of that scar tissue where the bladder sits with that uterus, there's lots of decreased mobility that happens in the bladder, meaning the bladder might try to stretch as it fills up with fluid, but that scar tissue might be hindering its stretchability. So you develop bladder urgency and you're peeing more frequently, or bladder discomfort, abdominal pain. So there is so much happening in that realm that we want to either decrease down the road of having low back pain, hip pain, lower abdominal discomfort, rectal spasms with our C-section moms that we can do. And then abdominally, muscle-wise with the pelvic floor, this is my huge one that when we look at our ACL injuries or knee injuries, we always go for quad sets, hamstrings, glutes. How are those functioning? And I feel like your transverse abdominis, those lower abs in the pelvic floor, need to be hit as often as we're hitting quad sets as we do with knees. Meaning every day we have to be tapping in and reminding the brain how to connect with that tissue where the nerves have been cut. And I think we're missing that on the pelvic health side. Another controversial topic. I'm not doing research on it right now. This is just having three myself. I felt like I had to do something every day, or that tissue was chilling out by the beach, relaxed, not helping me at all. So just a little, and it could be little. So often I've seen it on your guys' Instagram where you guys are, it may be blowing out, reminding to blow out as you're picking up, or blowing out and zipping up. It's reminding that tissue how to work and not just full on mom function. It's really taking the time on how you're lifting and moving throughout the day to make sure it's working well.
Yeah.
So true.
I love that. I feel like we could talk all day. Clearly, we all could talk all day on this topic.
Yes.
I think we just need to have another one on cesareans in general and like dive even deeper into that, because like you said, so many women think, oh, well, I'm fine. I had a C-section. Nothing else was impacted.
That scar is moving just superficially. And because that happens, I mean, not docking my girls when they come in, but we have so much training on this because the education we're getting in the pelvic health world, I'm like, but that's not realistic, guys.
Yeah.
There's so much more going deeper in that we've got to make sure we're looking at. So yes, I definitely agree.
Love that.
All right. Well, like Betsy said, I feel like we could talk forever, but is there anything that we missed or you want to touch on from, especially thinking about women who are in the gym, which is our audience, from a pelvic floor perspective? I know we covered it.
Yeah, I think we covered everything. Maybe just making sure if you are having, whether it's pelvic tension, pelvic pain, or bladder leakage, while you're in there with the weight rack, don't be afraid to hold on to it and do a deep squat and let the belly relax, let the pelvic floor relax before or throughout different exercises to help put that pelvic floor back at a full range of motion. Like give it that time to snap out of it and then get back in it.
That's a great tip.
Okay, I have one more
and
comment
not being
on that.
like, oh yeah, go ahead.
You're good. So I know of women specifically who I've advised that in the gym, and they are very afraid to toot. Tell us why tooting is good and okay. Toot, fart, that's the 3-year-old word we use right now is toot. Let's all use our own words, but why is it good for you? And why is it okay to just, if that happens, it's because you're relaxing and it's good, and let it out.
Yeah, they need to let it out.
That's all. Get over it.
Yeah, maybe we'll do the squat in the bathroom before the workout.
Outside.
That's what I typically suggest is like use your car, right? You can do it outside on your door of your car, or I used to lean into my steering wheel and see if I could get some to stretch out and see if you can let out a toot that way, because that's going to stretch out that backside, right? So you can do that. Also leaning into your steering wheel, and I have patients do this. Say you have bladder leakage before you're going into lift or whatnot, but you're going to lean into that steering wheel, let everything relax, and then you can try to pick up a blueberry, suck up a smoothie, and you can add in puckering at the same time. So that activates that urethra to wake it up a little bit. And the girls know they have to do that a few times, 2 to 3 reps, and then let it all relax again. And you may let some gas out when you're doing that. So
that might
happens. Everybody toots.
Everybody toots. That's yes. Everybody toots. Everybody poops. That's the book our boys are reading right now. Everybody toots.
They do. Awesome.
Love it.
Well, it was so great to have you. Before we hop off, tell everyone where they can find you, your Instagram, all that good stuff.
Yeah. Thank you for having me. I truly appreciate it. This was fun. I am empower.your.pelvis on Instagram, Empower Your Pelvis on TikTok. I believe it's Empower Your Pelvis on YouTube. We're starting to get more regular on there as well, but the website's empoweryourpelvis.com. I'm more than happy to talk about any of this. So you can always shoot me a message on Instagram. And then today's Wednesday, which is our Wellness Wednesday. So people will ask questions on Wellness Wednesday. I'll answer a few of them publicly. And then the other ones I like to message personally back. So you can always wait till Wednesday as well. But more than happy to help any way I can.
Awesome. Go follow Amanda. She is hilarious and so full of good information. All right.
Thank you, Amanda.
Thanks for listening to The MINT Project. If you enjoyed this episode, please go ahead and leave us a 5-star review and follow us on Instagram at The MINT Project. Project is spelled PRJCT. You can also visit our website for free resources, courses, merch, and more at themintproject.com. Until next time, keep crushing it.